We've been telling you about this flu shot clinic that is coming up. It's a drive-through clinic. Our conversation with Vickie Burgess from Aging Services and with Mary Lady from the Visiting Nurse Association, brought to you by Marcus & Mack, a law firm representing injured people. Ladies, good morning.
Good morning.
Good morning, Todd.
It's good to have you both with us here today. I guess in Mary's case, we could say lady.
This is true.
Okay, well, there we go. Okay, Vickie, give me the lowdown here. When is it? Where is it? Give me those sorts of details.
Okay, it's at the S&T Bank Arena. It is from 10 a.m. to noon on Wednesday, October 21st.
Mm-hmm.
And it's a drive-through clinic so that people can just come right through. They don't have to get out of their cars. They wear a mask. We wear a mask. We wear gloves. So it's going to be very safe, fast, and efficient.
Mm-hmm. And people are going to be concerned about cost for this. So can you help us with that financial detail?
I'm going to let Mary handle that one.
Okay, Mary.
Yes. Most Medicare persons of Medicare age, and even other insurances actually do cover the flu vaccine.
Mm-hmm.
So we will take care of doing the billing for those that do have Medicare. And other payer sources also. So we will have them fill out a form that they will then give to us. So they will need to have their verification of their insurance card with them so that we can verify that. And then we will take care of billing that. UPMC, Medicare B, Security Blue, Freedom Blue, and then there are a few other payer sources that do pay for this flu vaccine.
Mm-hmm.
If you do not have insurance, if the cost is $30 for the flu vaccine.
Okay, that's not bad. That's not bad at all for the kind of type of protection you're getting. Now, Mary, talk to me about the type of flu shot, because there are two out there this year, right?
There are. And actually, there has been two out there for the last couple of years. The regular flu, quadrivalent flu vaccine that has 4 different strands of virus in it that they have, the CDC has determined are going to be the most prevalent here in for this flu season.
Mm-hmm.
That is our regular dose. We then have what's called the high dose vaccine, or the flu high dose. It contains 4 times the amount of antigen as a regular flu shot. It's associated with a stronger immune response following the vaccination.
Mm-hmm.
It makes that body have a higher antibody production. So that is strictly reserved for persons that are 65 years or over.
Oh, okay.
So you have to meet that guideline. It would be the same cost. It's the same cost that we are going to be charging persons, although actually it does cost more, but we are still charging just $30, whether it's the high dose or the regular flu vaccine.
Okay, so that high dose for those 65 and over, that's sort of like the Charles Atlas of flu shots. It kicks sand in the face of flu, right?
That's true. That is true, yeah. I mean, studies have shown that they get a 25 or 24% fewer influenza illnesses following that higher dose.
Mm-hmm.
So we do recommend that higher dose for persons over 65.
Yeah.
But the flu vaccine is actually recommended for anybody 6 months or older. So all of us, if you're 6 months or older, should really be encouraged to get their flu vaccine, especially during this pandemic.
Yeah, I want to talk to you more about that in just a moment. Vickie, let's talk about how people are going to get this shot. And, of course, with the pandemic out there, people have concerns about getting out and getting involved and meeting with people. Don't have to worry about that with this, right?
No, not at all. When the VNA and I started talking last July and August, and we were really throwing around what we could do, and it wasn't until this last month that we got together and said, hey, we really want to do something for the community, because we used to hold it in the senior centers, and obviously we can't because of COVID. So we came up with the idea of a drive-through, and we had White Township and the Emergency Management System and the VNA and us aging services got together so that we could provide this, and we thought, what better way to do it than a drive-through where people don't have to get out of their cars. They wear a mask, we wear a mask, so it's a win-win situation for everyone.
Yeah, so mask up, and you can get that done. Now, if people in multiple people in a car, you can handle that and just go window to window. Is that how that works?
Yes, that's what we would do. And we'll probably have, and you know what, EMS has been really very supportive of this, and I want to also, it pays to have connections. Mm-hmm. I did use my connection with White Township. And actually, you know, my husband actually was the one that actually kind of gave me a few ideas about seeing if EMS can help us out. So, yes, there should not be any problem. We will have different people stationed. We will have persons that will help with the flow of the traffic. We'll have the papers that can be filled out ahead of time as they pull up. Then we will station people as they pull up. They receive their flu vaccine. We'll ask people to stay in another section of the parking lot. And S&T Arena has a large parking lot, so that they can stay there just to make sure there's no kind of side effects from that. So it's kind of, we're working with, we're kind of doing this in preparation. You never know when you might need to do another type of pod or a type of vaccination. So we're kind of using this as a little bit of an experiment. Although they have done them in the past, EMS has. So EMS has really been charged with helping out with some of the supplies that we'll be needing. And if it's not that great, but we can never plan that in one day, so we will have a canopy that will be put over so that people, when they open their doors, they won't get wet if it's raining.
And I do want to interject in there that the fact that this is something that down the road that we used to have it at the senior center. Because of COVID, it's changed everything. So down the line, we might just end up doing this yearly because it will be safe and for seniors.
Yeah, absolutely. That might be one of the things that we learned from the pandemic is more efficient ways of distributing flu vaccines and whatever else we come up against. Vickie, I want to talk to you about the need for seniors to be especially vigilant during this season. It's not just the flu shot. It's protecting yourself from contact with others, and especially now with the pandemic, it's extremely important for seniors to guard after their health, and for people who deal with seniors to understand their concerns too, isn't it?
This is something we preach every day. It is absolutely necessary and vital that people follow the CDC guidelines with wearing a mask, staying 6 feet apart. We as aging services, we promote health and wellness to seniors, and so this is our number one concern, and we make sure that we follow the guidelines but still offer services to the seniors in our community. But yes, I can't stress enough how important it is, because obviously we all know that when you're 60 and older, you're much more liable to be affected by COVID-19 or the flu. So that's why it's so important to get a flu shot.
Yeah, we're talking this morning with Vickie Burgess from Aging Services, married lady from the Visiting Nurse Association. Mary, in the pandemic era, obviously people are being extra careful, and it is so important for folks to realize that this flu can spread. We ought to know this because we get the flu reports every year. Flu spreads, and combine that with coronavirus, and seniors have many times underlying health issues that make it even worse for them. So this is really big for them.
Oh, it's huge. We have been distributing the flu vaccine to our patients when our staff go into the home probably for the past at least probably month, I would say. And it's really encouraged. October, in my opinion, now you can get it in September. I think October is the prime month to really do it so that it carries you over into those later February, March months when we still have flu out there, and you still can have some in April even. So So, yeah, we've targeted October as being the time that we really wanted to focus on that, and we've been really giving a lot of flu vaccines out already. We did start probably mid-October, or I'm sorry, mid-September.
Yeah, but getting that flu shot now is going to probably carry you all the way through the season.
Correct.
All right. So the drive-through flu clinic is going to be happening at the S&T Bank Arena at the White Township Recreation Complex Wednesday, October 21st, 10 a.m. to noon. For safety reasons, just stay in your vehicle, wear your mask, pull up. They'll take care of you from there. They'll handle the insurance as well if the insurance is involved. And if none of your insurance plans cover it, odds are it's going to cover it. But if it doesn't, then just $30 for this. Vickie, is there a number or Mary that folks can call if they need some more information?
Yes, you can call the VNA at 724-463-6340.
Mm-hmm. Or you can call Aging Services to find out more information at 724-349-4500.
And we should emphasize this isn't just for people in Indiana or White Township. This is for people in general, correct?
Definitely.
All right.
All is welcome.
Is there a limit on the number of shots that will be available? Do you have just a limited number of doses?
There is a limit. I don't have that number right now, but I would say, you know what, if you haven't gotten your flu vaccine by the 21st, please come in to our clinic. We have plenty of doses. The higher dose, those are going fast, so we would encourage anybody that can is to get to our clinic.
Absolutely. All right, ladies, thank you both for being with us this morning. We appreciate it.
Well, thank you. We've appreciated our time with you.
Yes, thank you.
Have a great day.
You too. You too.